previous lecture, I have discussed in details about penicillins. Today in this session, I am going to talk about cephalosporins, the different generations of cephalosporins, the antibacterial spectrum and the therapeutic uses based on the antibacterial spectrum, some of the characteristic features of specific cephalosporins and the adverse effects of cephalosporins. So broadly, the cephalosporins are divided into 5 generations, generation 1 to generation 5. So let us first see the antibacterial spectrum of different generations of cephalosporin. So the first generation of cephalosporin was introduced in the year 1960 and it is highly active against gram-positive organisms such as Staph aureus, Streptococcus, Pneumococcus. But to be noted that it is not active against methicillin-resistant Staph aureus. It has little activity on gram-negative bacteria. Therefore, this generation of cephalosporins is used for the treatment of infections that are caused by gram-positive cocci. So, as we move from the first generation to higher generations of cephalosporins, the activity on gram-negative bacteria increases. So, the second generation of cephalosporin, which was introduced in 1970, retains activity on gram-positive cocci, and it has higher activity compared to first generation of cephalosporin against gram-negative bacteria, including Neisseria gonorrhoeae. So, gram-negative bacteria such as E. coli, Klebsiella, Proteus are affected, including Neisseria gonorrhoeae, which is a gram-negative cocci. But here to be noted that Pseudomonas, which is a highly resistant organism, it is a gram-negative bacilli, is not affected by second generation cephalosporins. So second generation of cephalosporins is not used for the treatment of infections that are caused by Pseudomonas. So Pseudomonas is an exception to this generation of cephalosporin. Also, it is to be noted that anaerobic infections can be treated with second generation of cephalosporin. So second generation of cephalosporin has marked anaerobic activity. Now, as we move to the third generation of cephalosporins, the activity on gram-negative bacteria increases. So, it is highly active against gram-negative bacteria, including Pseudomonas. So, many of the members of third generation of cephalosporins can be used for the treatment of infections that are caused by resistant microorganisms such as Pseudomonas. Also, it is highly active against Klebsiella, Proteus, Enterobacter, including Neisseria gonorrhoeae. So now let's move to the fourth generation of cephalosporin, which has high activity on gram-positive cocci and gram-negative bacilli, including Pseudomonas. So this group or this generation of cephalosporin is highly active against gram-positive, gram-negative organisms. Pseudomonas is also affected. So resistant infections can be treated with fourth generation cephalosporins. Now coming to the fifth generation of cephalosporin, which includes ceftaroline, which was introduced in 2010 and it is highly active. It is used for the treatment of methicillin-resistant Staph aureus infections. So although the first generation of cephalosporin was highly active on gram-positive organism, but it was not active on methicillin-resistant Staph aureus. So methicillin-resistant Staph aureus infections are treated with the fifth generation cephalosporin and the drug is ceftaroline. So based on the antibacterial spectrum, cephalosporin antibiotic is selected. So now let's see what are the antibiotics that are included in different generations of cephalosporins. So the first generation cephalosporin includes cefazolin, which is given intravenously because intramuscular injection is painful. So it is given intravenously. And some of the characteristic features of cefazolin is that it has good tissue penetration and secondly, it is highly active against Staph aureus, the causative organism for skin and soft tissue infection. It is preferred for surgical prophylaxis before cardiac surgeries and orthopedic prosthesis procedures. The other antibiotics that belong to this first generation cephalosporin is cefadroxil and cephalexin. Both these antibiotics can be administered orally and are used for the treatment of upper respiratory tract infection such as pharyngitis, tonsillitis, and can be used for the treatment of skin and soft tissue infections such as impetigo cellulitis. But the drawback of first generation cephalosporin is that it is not active against methicillin resistant Staph aureus. Secondly, it has insignificant activity against gram-negative bacteria. So gram-negative infections are not treatable with first generation cephalosporin. And thirdly, they are highly sensitive to beta-lactamases. So beta-lactamases are the enzymes that are produced by gram-positive and gram-negative bacteria that hydrolyze the beta-lactam ring, making the antibiotic ineffective. So to overcome this drawback, the second generation of cephalosporins were developed, which are more stable to beta-lactamase enzymes, and therefore they can be used for the treatment of infections, the organisms that produce beta-lactamase enzymes. Now speaking of the second generation of cephalosporins, which have activity against gram-negative bacteria and also has anaerobic activity. So this group of cephalosporins is active on anaerobic organisms, and the two antibiotics that show anaerobic activity are cefoxitin and cefotetan. So cefoxitin and cefotetan can be used for treating anaerobic infections such as intra-abdominal infections, that is appendicitis, diverticulitis, peritonitis. Secondly, pelvic infections such as pelvic inflammatory diseases and endometritis can be treated with these antibiotics. Surgical prophylaxis for abdominal and gynecological surgeries can be given with these antibiotics, and diabetic foot can be treated with cefoxitin and cefotetan. Also to be noted that cefuroxime, which belongs to second generation cephalosporin, attains high concentration in the CSF, and therefore it can be used for the treatment of meningitis. It can also be used for the treatment of gonorrhea because a single intramuscular dose of cefuroxime can be used to treat gonorrhea. Now coming to the third generation of cephalosporins, which have high activity on gram-negative bacteria including Pseudomonas. So cefotaxime, which is the prototype of this generation of cephalosporin, attains therapeutic levels in the cerebrospinal fluid. Ceftriaxone also attains high concentration in the cerebrospinal fluid. So cefotaxime and ceftriaxone can be used for the treatment of meningitis, which is caused by gram-negative bacteria such as H. influenzae and Neisseria meningitidis. Also, these antibiotics can be used for the treatment of severe cases of community-acquired pneumonia and septicemia caused by gram-negative bacilli. Some of the other uses of ceftriaxone is that it is highly effective for the treatment of drug-resistant typhoid fever, which does not respond to fluoroquinolones. Also, it is the drug of choice for sexually transmitted diseases. For example, in gonorrhea, ceftriaxone is the preferred drug. It is combined with low dose of azithromycin, and this is advocated by WHO. Also, for the treatment of syphilis, ceftriaxone is an alternative to penicillin, which is the drug of choice in syphilis. So, ceftriaxone can be used for the treatment of sexually transmitted diseases such as gonorrhea, syphilis, chancroid, which is caused by Haemophilus ducti, a gram-negative organism. So, ceftriaxone is widely used for the treatment of meningitis, septicemia, community-acquired pneumonia, sexually transmitted diseases such as syphilis, gonorrhea, chancroid, drug-resistant typhoid fever, Lyme's disease. Now, the two antibiotics that are active on Pseudomonas organism are cefoperazone and ceftazidime. Ceftazidime has better activity on Pseudomonas than cefoperazone. Cefoperazone and ceftazidime are preferred for the treatment of meningitis, which is caused by Pseudomonas, or septicemia or hospital-acquired infections where Pseudomonas is the causative organism. Also to be noted that while most of the cephalosporins are excreted through the kidney, or kidney is the route of elimination for most of the cephalosporins, cefoperazone is partly excreted in bile. So it is excreted in bile, so it does not require dose modification in renal failure. Now, some of the oral third generation cephalosporins is cefixime and cefpodoxime. So, they are given orally for the treatment of mild to moderate urinary, biliary and respiratory tract infections. A single dose of cefixime can be used for the treatment of uncomplicated gonorrhea. However, to be noted that cefixime is not active on Pseudomonas and therefore is not preferred for the treatment of infections that are caused by Pseudomonas organism. Cephalosporin is similar to that of cefixime, excepting that it has activity against Staph aureus, whereas cefixime has no action on Staph aureus organism. So this was all about the third generation of cephalosporins. In the fourth generation of cephalosporins, we had cefepime and cefpyrone, and these two antibiotics are highly active against organisms such as gram-positive cocci, gram-negative bacteria including Pseudomonas, and therefore they are used for treating resistant infections that do not respond to third generation cephalosporins. Septicemia, severe cases of hospital-acquired pneumonia can be treated with fourth generation cephalosporins. Now moving on to the fifth generation cephalosporins, where ceftaroline is included as a fifth generation of cephalosporin, and it is useful for the treatment of methicillin-resistant Staph aureus infections. So complicated infections that are caused by methicillin-resistant Staph aureus is treatable with ceftaroline, which is a fifth generation cephalosporin. Now let's talk about the adverse effects of cephalosporins. So pain can occur after intramuscular injections due to cephalothane and cefazoline. Secondly, diarrhea can occur with orally active third generation cephalosporins such as cefixime and cefoperazone, which is excreted in bile. Hypersensitivity reactions are important. The manifestations are same as that of penicillin. However, the incidence is rare. Nephrotoxicity is a possibility with cephalosporin. So cephalosporin has been reported to cause nephrotoxicity. Bleeding or coagulation abnormalities manifested by a rise in prothrombin time has been observed with antibiotics such as cefoperazone and ceftriaxone. So ceftriaxone and cefoperazone is known to cause bleeding problems because of coagulation abnormalities. There is rise in prothrombin time, and the antibiotics are ceftriaxone and cefoperazone. Disulfiram-like reaction has been reported with cefoperazone. So cefoperazone has been reported to cause disulfiram reaction and interaction with alcohol. So in this lecture, we have covered the different generations of cephalosporins, the antibacterial spectrum, therapeutic uses, characteristic features, and adverse effects of different groups of cephalosporins. So thank you for watching. Please like and subscribe to this video if you find this video useful.